Back here now at 9:22 on Live Impact News with respiratory season right around the corner. Health experts say pregnant women and their newborns may face some of the highest risks. Joining us now is Dr. Kevin Ault, president-elect of the National Foundation for Infectious Diseases. Good morning, doctor. Thanks for joining us here this morning.
Good morning. Thank you for having me.
Let's start with the general idea for vaccines. What are the ones that are recommended during pregnancy, and how does a vaccinated mom actually protect her baby in those first few months of life?
Well, I think you started out well by talking about protecting newborns. One of several reasons that we give vaccines during pregnancy is so that the mom will make antibodies, the pregnant person will make antibodies. Those antibodies cross the placenta and end up in the fetal circulation. So the newborn has a full set of antibodies against pertussis, which is whooping cough, flu, influenza, and RSV, or some of the other vaccines that are going to be recommended during pregnancy. For flu and COVID, pregnant women can be very ill with those respiratory infections, and we not uncommonly see pregnant women hospitalized or in the intensive care unit for flu and COVID during that peak winter season.
And why is that window right after birth so important or dangerous for newborns when it comes to something like RSV or whooping cough?
Well, those tiny little airways that those babies have are very vulnerable, plus the relatively lack of immunity that newborns are going to have. It takes several months to build up immunity to pertussis, and so we do give that in the first few months of life, but we don't have a great strategy for RSV. I guess we do have great strategies because we have new interventions, but you can imagine a newborn being very vulnerable to respiratory infections. I think most parents know that about RSV.
Let's talk about vaccine access or coverage right now. Why does insurance coverage for maternal vaccines matter so much?
Well, it matters so much for a couple of reasons. The main reason is it alleviates lots of suffering. It reduces hospitalizations during pregnancy. It reduces hospitalizations of newborns. You know, there's nothing more frightening to new parents than to have their child in the hospital within the first few weeks of being born after you've taken them home. And so it does all those things. It's also very cost effective to do this. Keeping people out of the hospital saves money for Medicaid and for private insurance companies. And private insurance companies have really stepped up and said, we're going to cover these recommended vaccines during pregnancy and childhood.
And for those reluctant to get a vaccine, what does the latest research actually show about vaccine safety during pregnancy?
Well, the shortest possible answer I can give you is that there are hundreds of studies that back up each of those four vaccines. For flu, it started being recommended during the middle of the last century, so we have, decades of data about that. For something more recent like COVID, we still have hundreds of studies to talk about the safety of that vaccine given during pregnancy. There's been some excellent publications fairly recently about RSV and how effective it is. So we have data both about effectiveness and safety both.
All right. For families who already had a baby without the vaccination for the mom, is it too late to maybe catch up on their vaccination this season?
No, it's really not too late. And I keep talking about RSV because it's so common. We actually have two ways to prevent RSV. A pregnant woman can get vaccinated during her pregnancy, or if you have a baby that's a few months old, you need to talk to your pediatrician or family doctor about getting what we call a monoclonal antibody to prevent RSV during this upcoming season. And we usually give those to babies. I'm not a pediatrician, I'm an OBGYN, but we usually give those to babies during the first 8 months of life.
All right. Anything else we need to know this morning, doctor?
Well, I think there's some good websites you can look at to kind of straightens out some of the information that we only talked about briefly. Vaccinate Your Family has an excellent website. The American College of Obstetricians and Gynecologists has frequently asked questions, including some about vaccine safety that you asked me about. And the American Academy of Pediatrics has a very good website called Healthy Children that touches on vaccines, but also is a pretty broad overview of just caring for your child.
All right, very good. Good information, great resources, and thanks for the important conversation, Doctor. Appreciate your time this morning.
Thank you for having me.